Next, we have free paper 469, Novel Diagnostic and Treatment Algorithm, by presenting author Dr. Bharat Gurnani.
Good afternoon, one and all. I'll be presenting my paper on novel diagnostic and treatment algorithm for pythium keratitis, redefining management guidelines. We have no financial disclosures to make and no conflict of interest. So we should know what are the existing challenges in pythium keratitis. A rare keratitis recently in upsurge. Clinically and microbiologically, it mimics fungus and is also called as parafungus. The specific diagnostic method is a DNA zoospore identification, resistant to conventional antifungal and responds more to antibacterial as per literature, and has poor outcome with therapeutic keratoplasty, and there is high risk of reinfection and phthisis. Coming to the introduction, pythium is an oomycete commonly seen in tropical and subtropical region, also called as parafungus. It lack agosterol in the cell wall. The purpose of our study was to analyze the demographic profile, the clinical diagnostic features, challenges in management, treatment outcome, and to propose a diagnostic and management protocol. It was a retrospective study design done during the period of October 2017 to March 2021. 41 pythium subjects were recruited from the Cornea Clinic of the Tertiary Eye Care Center in South India. During the study period, we studied 2631 ulcers. Out of that, 1398 were culture negative, 998 had fungal positive, bacterial were 194 were positive for bacteria, and we had 41 pythium subjects. So in the inclusion criteria, we had all clinical pythium keratitis subjects who were culture positive, clinically appearing fungal keratitis but were culture positive for pythium, and button culture cases post TPK which were positive for pythium. In the exclusion criteria, we excluded clinically appearing pythium cases but culture negative. All other infective and non-infective keratitis cases were excluded. We designed a novel diagnostic and treatment algorithm based on our experience. All the clinical cases of pythium were subjected to smearing and culture, and before culture results, antifungals were given to all patients, and zoospore was identified by leaf incarnation method. In the culture positive arm, if the ulcer size was less than 4 by 4, they were treated with linezolid monotherapy, and if the ulcer size was more than 4 by 4, we treated with linezolid and azithromycin combination. In case of good response, the same treatment was continued, and in case of poor response, patients were subjected to TPK. And in case of early stromal melt cases, we used glue and BCL. In the culture negative arm, if the ulcer size was small, we used natamycin monotherapy. And the ulcer size was more than 4 by 4, we used natamycin, voriconazole or itraconazole combination. Good response, the same treatment was continued. In case of poor response, they were subjected to TPK. And the button culture was positive. They were treated as pythium subjects, and we started anti-pythium drug. And in case of recurrence requiring TPK, we did a repeat TPK. Coming to the demographic, 15 subjects were less than 25 years of age, 21 were more than 26 years of age. In the sex distribution, 40 were females and 40% were females and 60% were males. Demographic and clinical feature, the most common were farmers, 18 patients, followed by 12 students and 11 housewives. Injury was the most common mode of risk factor in 30 patients. The presenting visual acuity was less than 1 by 60 in 18 patients, and the presentation lag was less than 10 days in 20 patients. In the clinical features, stromal infiltrate with hyphated edges was seen in 15 patients, 8 had a corneal melt, 11 had subepithelial infiltrate spreading to limbus, 9 had peripheral furrowing, and 12 had tentacular projection. Hypopia and anterior chamber exudates, 18 patients, endothelial plaque was seen in 12, and perforation was seen in 5 patients. So this first image shows the tentacular projection of ulcer margin, the second shows the peripheral furrowing, third shows the tendency to spread toward limbus, and fourth shows the whitish plaque with hypopia. These are all the hallmark features of pythium which we used during our analysis. Staining culture and zoospore identification, the first image shows KOS staining, which shows the pythium filament. The second image shows the long, slender, linear aseptate hyphae of the pythium. The third is a leaf incarnation with the zoospore can be seen here. And the fourth, fifth, and the sixth image shows the blood agar, chocolate agar, and potato dextrose agar, white, fluffy, cotton wool-like colonies of pythium. Coming to drug details, before culture result, we used 19 patients given with natamycin and voriconazole combination. 12 had natamycin itraconazole. Natamycin alone, if the ulcer was superficial, we gave in 11 patients. After culture positivity, we added azithromycin in 27 and linezolid as a first-line drug was added in all patients. 13 healed with medical treatment, 28 required a therapeutic graft, 11 had graft reinfection, 4 were lost to follow-up, 5 needed glue and tarsorrhaphy, and the average time to TPK was 11 days. So this image shows the recurrence of infiltrate in the post-TPK, showing the virulence, and the second shows the anterior chamber clump exudates in the anterior chamber, again showing the virulence. Third image shows total corneal melt post-TPK, and again show total corneal melt will infiltrate. Coming to complication, we had one case with evisceration, 20% 20% and secondary glaucoma. Choroidal detachment was seen in around 27%. Graft reinfection, retinal detachment, endophthalmitis were other complication. Glove salvage rate was high, 88%. 12 had a phthisis. 9 patients had visual acuity greater than 6 by 60. 9 had 1 by 60 to 6 by 60. 19 were positive, PL positive, and 4 were PL negative. So comparing medical group with the surgical group, there was no statistical significant association between the two groups. So in our analysis, we had 41 subjects during the study period, which is a good sample size compared to the previous studies published. Approximately 70% needed TPK, 30% healed with medical treatment. Repeat TPK rate was around 27%. One had a evisceration. Glove salvage was high, 88%, and 12 had phthisis or no PL. So to sum up, pythium is more prevalent in younger patient population. Most common clinical finding is stromal infiltrated with hypatid edges, and specific findings are peripheral furrowing and tentacle. TPK is a treatment of choice. 30% heal with medical treatment. If managed aggressively, glove salvage rate can be high. Early diagnosis, meticulous management, and regular follow-up are key in managing these cases. Based on our experience as well as literature review, we further refined our protocol. We added the newer stains which are available recently, and this is our protocol for the study period. Thank you.
This is a very, very nice study, and indeed, uh, to get so many cases and to diagnose them, I think, is remarkable. And the fact that you will have salvaged so many eyes, again, is remarkable. But it's also very, very, what has caught my attention is that you've said that it's basically students who are getting it. So I was wondering how come. You said farmers 18 and the
Yes,
rest of them are students. Why such high number of students?
that was, ma'am, slightly challenging to know why they are having. We were also not able to, like, there was a young patient, 21 years old. We were not able to see why this patient developed. He had a history of clay use. So he told me, I am working with clay and something like that. He was a professional. So maybe it's due to mud induced or soil.
But none of the other publications have talked about what is the etiological factor causing it.
Other publication also speaks on the same guideline. Like more, like few studies have seen more than 50% to be housewives and software professional or younger generation, and other one or two studies have seen like 60% to be farmers. So there is a mixed literature available on this. So we also had similar kind of like our patient population was like around 15 patients were less than 25 years of age.
Do you feel that the corneal presentation initially looks quite different from the other presentations that you get, let's say, because of other bacteria or fungi or whatever?
Well, there is a
What makes
mixed
you suspect that?
like sometimes there is a mixed picture, like you think it's a fungal only. So after once you see after 5 days you have given the treatment, and when the patient turns up and your treatment not working, the ulcer has flared up, then you start thinking like maybe we are missing something. Then if you go back on to see on the culture, it comes pythium positive.
So when you are taking also the culture, let's say taking the slides, do you feel that there is a different feel to the when you're taking the infiltrate from for let's say a study? At that time, do you feel that it is a different feel while you're taking the infiltrate, or it's the
Maybe
same feel?
more cheesy cotton, like cheesy. It's a more cheesy material compared to fungus, what I believe. Like, but it's difficult to pinpoint on the first visit, like is it fungus or what. That's why we still say like antifungals still have a role to play, because pythium being very rare, fungus being on the higher side, so we have to treat it as fungus for 5 days. Later, once the culture reports are available, only one report says that only fluorescent microscopy can differentiate the hyphae on day one, which may be a limitation since it's not available at all centers.
Thank you.
Thank you.
Yeah, yeah, please.
So, Dr. Bharat, you had excluded the consecutive ones in the beginning.
Yes, ma'am.
So, did you not opt for a PCR diagnosis in those which would have increased your study number?
Yes,
And
ma'am.
at SM, we believe that PCR is more diagnostic compared to zoospore formation, which is more generic represents the genus rather than.
Ma'am,
Why did you not opt for
this was one of the limitations of our study. Like we didn't subject all the subjects to PCR, which could have been more
Yeah, I
informative.
think
And
I think that's a very good point. Yes, yes, definitely.
all
So,
patients were not affording also, and secondly, we were not aware initially like PCR can be more diagnostic on day one. But now recent literature revealed that besides culture, PCR is the gold standard. Thank you.